Hello, my name is Ken. I'm going to be a nurse practitioner student today taking care of you, okay?
Okay.
And can you tell me your name and date of birth?
4/15/93, Wendy Garcia.
Good to meet you, Wendy. And are you in any pain today?
I'm not.
Good. And then you don't look like you're in any distress or anything to me, so everything looks good. I'm going to do an assessment on you today. We're going to listen to your lungs, we're going to listen to your heart. I'm going to check your peripheral arteries and your pulses, and then I'm going to listen to you a little bit and do a little bit of percussion, okay? So first off, I just want to have you do some normal breathing for me, and I'm going to assess your rate and rhythm, okay? Okay, about 16, 17 breaths per minute. No accessory muscles are being used. And so palpate your sternal notch here, and everything looks good. All right, I'm going to move to your back, and I'm going to ask you to do a little breathing for me, okay? So if you'll just take some deep breaths in and then out through your mouth. And again. And again. Good. So just kind of see how everything looks symmetrical. And then if you'll do that, if you'll just say 99 for me for a few times over for me.
99, 99, 99, 99.
Good. Excellent. Okay. No, so that was testing for your tactophromidis there is what I was doing with the 99, okay? So I'm going to do what we call a little percussion, so on your back here. Excellent. And I don't see any abnormalities going on with that, okay? I'm going to listen to your lungs all the way across, okay? Just take a deep breath in and out for me. And again. Good. So now I'm going to move to the anterior front, okay? So I'm just going to do a little bit of inspection first, and then we'll listen to you. So inspection-wise, everything looks symmetrical. I don't see any scars or lesions or anything on your chest. So I'm going to listen to your breath sounds from the front. Just breathe a deep breath in and out for me. Good. And then here I want you to say 99 for me.
99.
A little louder for me.
99.
And again.
99. 99.
Good. Excellent. Okay. I don't see any abnormalities with there. So now I'm going to have you lay back, and I'm going to listen to your different heart sounds, and then First I'm going to see if I have any thrills or bruits or anything like that, okay? Nothing there. And PMI, 5th intercostal, regular and strong. I'm going to listen to your heart sounds. So listen to your aortas and your pulmonic. Third intercostal, your tricuspid at the 4th and 5th intercostal, and your mitral or your apex. Excellent, good. Okay. I'm going to look at your carotids now. First I'm going to listen, and then I'm going to palpate, okay? So maybe a little ticklish, so just bear with us. So hold your breath for me for a minute. Now you can release. Now we're going to go to the other side. Hold your breath. And release. Good. turn your head this way for me. And then back this way for me. Excellent. No thrills, nothing felt there. So that is good. I'm going to inspect your abdomen, okay? So I'm going to pull this down here. We're going to keep you covered. And from the looks of it, I'm going to see a belly button piercing here and no infections or anything wrong with that. Okay, I see some striae. I see flat. We have a flat tummy, and I see a scar. It looks like a cesarean scar in your upper pubis areas. So I'm going to listen to your bowel sounds, okay? Good. Sounds like you're a little hungry. I'm going to listen to a couple of more areas, okay? This is going to be your aortas area, your iliac, and your renal area, and your femoral, okay? I'm going to do what we call a little percussion, okay? And this is a little light palpation. Any pain or tenderness? And we're going to get a little deeper with it, okay? Any pain or tenderness there? Excellent, good job. Okay, and now as we move on, I'm going to, after I do those deep palpations, I'm going to try to find your liver. I'm going to palpate for your liver, and then we're going to palpate for the spleen, okay? First, I'm going to use the technique of, I'm going to pull up, and I want you to take a deep breath in and then let it out for me. One more time. And I'm going to try this other method here, the hook method. If you'll do the same thing, just breathe in for me. One more time. Good. And then for your spleen, I'm going to pull up and then breathe in and out for me. Excellent. Good job. Okay. So I want to assess for your, you hear me, sorry, I didn't mean to leave you laying down. There you go. All right, so I'm going to look back here. It's called a percussion with my fist. I don't want to hurt you, so I'm going to do this, but it's ever so lightly, but let me know if you have any pain here, okay? Anything there? Everything's okay there? Good. So now I'm going to assess for your pulses. So I'm going to start with this one here. We're going to do your radial pulse, your brachial pulse. Now go to this one, the radial pulse, the brachial pulse. Now I'm going to get your posterior tibial pulse and your dorsalis. And your tibial and your dorsalis. Now I'm going to check for edema. I don't see any edema or any leg swelling or any pitting. And I'm getting a 0 on the pitting. All right, that will conclude our assessment. Do you have any questions or concerns for me?
No, I don't.
Well, thank you so much for letting me do this assessment on you. And if you have any questions or concerns, you please call our office, okay?
Thank you.